All right, guys. So another exciting one. We have Dr. Bilal Tasneem back again. Recently had a global health trip to Gambia. Correct me if I'm
Yeah,
wrong.
no, no,
And yeah,
absolutely.
I just wanted to bring him on and basically talk about it a little bit. So welcome.
Yeah, thank you so much for having me, man. I really appreciate it. This one goes out to everybody that's messaged me about it too, and wants to know more about this trip. Honestly, it was something else, and I hope that Justin and me shooting the shit about it inspires some other people to want to jump on board. Yeah,
Yeah, yeah. And I mean, it's a while now we're supposed to talk about this, but I think one big thing is that it could be something for those getting into residency soon to even look forward to. I know there's a lot of people that have,
yeah,
goals of doing medicine abroad or in their home countries, stuff like that. So hopefully this
absolutely.
would inspire somebody to show them that it is actually possible. So Gambia, how did this opportunity even come about? Like,
Oh,
just give us a brief.
absolutely. To start off, Justin and I have already had conversations about this many times, and the reason I bring this up is eventually. So my entire goal has been doing global health medicine. I love emergency medicine. I absolutely love traveling, and I love people and languages, and it all just kind of combined together. All my entire life, just doing this over and over, and realizing like this is what I want to do. All the countries I've gone, all the people I've met, like this is the kind of this would suit everything I want. And hopefully one day, with the help of Justin and some of the other people like Arslan, like people that I know are close knit that want to do this, we're going to create something real. Hopefully, a real global health foundation. We'll see. We'll see. Yeah. All
Yeah.
we need.
So how did this opportunity come about to
So
even
the reason
get
I brought
to?
that up, I know I get distracted. The reason I brought it up is because
Yeah.
I talk about this to everyone that will listen. Like since medical school, high school, this has always been something I've talked about. And because I did, I basically that's how I made connections with so many people too. I talked about it to everyone. And remember when I did that acting stuff in New York?
Hmm. Yeah. So
Yeah.
he was what was the TV? Some TV show you did,
It was just like some
Bollywood.
Bollywood web series kind of thing, and it
Yeah.
was fun. It was
Maybe we'll have a little B-roll of one of the clips here right now. I'll tell
please
them when
never.
insert it. Yeah.
uh,
But yeah, tell me. Yeah.
I
So.
don't do scripts,
Uh-huh.
man. Yeah. So one of the girls working on the show, she was actually a doctor and an attending. And so as soon as I found that out, I gave my spiel. I told her all the stuff I wanted to do because she did all this global health stuff. Dr. Ifit, just absolutely a
Hmm.
phenomenal human being. And so I was telling her, and she laughed, and she was like, "Okay, calm down." She's like, "Maybe when you're a resident or an attending, we'll talk about this.
Hmm.
Talk about you like
Right.
actually come on these types of trips." And so I just kept throwing it out into the world, and because of that, it came back around. So maybe 4 or 5 months ago, because I went maybe two or so months ago, I she texted me and she sent me this blurb. She was like, "Hey, look, you're finally in the mix of things. Like you're a resident. You got some work behind you. You know what you're doing." I
Hmm.
have a friend of mine, Dr. Cisse Nafi Cisse. She has her own organization. She
Dr. What?
goes,
Sorry.
Dr. Nafi Cisse.
Okay.
Yeah, she's from
Hmm.
Gambia, and she's a doctor here in the U.S. And she has her own organization that goes out to Gambia. It's something she created. It's absolutely phenomenal. She goes out every 6 months and just helps so many people in Gambia. And honestly, it's a private organization. She funds majority of this on her own. She does this because she loves like helping people and going out and just watching this woman work. Honestly, you see that just a true bleeding
And
heart. And
and where does she practice, Dr. Cisse?
Dr. Cisse, I believe she's out in Washington.
Okay. Okay. Okay.
Yeah, but going forward, so she gave me this opportunity. If it, she told me to link up with her, and funny enough, I actually got really busy and I didn't message her back for a good month. And later, Ifit and I had this conversation. She was like, "It was all fate." She was like, "I threw you the message. I was just gonna see what happened, let the world take its course." And she was right. A month later, I opened it up. I was like, "Oh crap, I missed this." I was like, "There's no way my program will let me do this. There's no way I'm gonna be able to like figure this out. There's so many moving parts. There's only a
Hmm.
month left." I don't know, man. I was like, I cannot believe I even said that. I was like, the Bilal I know would take any opportunity to do medicine and to travel. And so,
Residency changes you, you know?
oh, it scared me. That was like 5 seconds of doubting myself. I was like, oh, it's too tough. I can't figure this out. The money, all of it, the traveling. Anyways, all those moving parts fit together, and I talked to the right people, set up the right things, had to work, finagle a lot of things, but then it worked
Bilal,
out. People can see your passion. People can see when you really
right.
want to do something. And
Is
I
it
didn't take no for an
mhm.
answer.
Is it something that well, based on your experience at least, is it something that program directors may be open to giving you time off for with even
Your
within a month or? Mhm.
your program director, in majority, wants to help you towards your career, towards what you want. And if you show them that this is the best thing for my career, and I showed my program director this was the best thing for my career. This is going to push me to the next level. This is going to help me get where I want to go. And he was more willing to work with me at that time. And yeah, you have to use PTO time. Yeah, you have to use your own money. Like, but this thing is, this is important to me. This is something I wanted to do. I sadly, but like, I still had funds from other places. I was able to get my own money together. I even got our pharmacy to give me drugs to take with me, like
Okay.
all these things. So it's all about how you word
Okay.
it.
All right. So, okay. So you finally got approval from your program. Everything is in place. Was there a checklist of medications, different things that you had to prepare for to even take on the trip? Give us
The,
some guidance on that. Hmm.
Yeah, absolutely. There always is, but you have to understand in most of these countries overseas, in Gambia including, you don't have access to things that we have access to all this without question. Like I'm talking Tylenol and ibuprofen, and we were walking around with so much Tylenol, ibuprofen, and I think we were the hottest commodity in Gambia solely because of those two
Okay.
medications. It's ridiculous.
So, so mainly Tylenol, ibuprofen. What else were you guys carrying?
Antifungals, bacitracin, antibiotics, creams, augmentin, clindamycin, azithromycin, a bunch of antibiotics, some steroids, inhalers as well, fluticasone pumps, things like that.
Any
Yeah,
Narcan?
I mean, honestly, no. What did I just say? The Tylenol and ibuprofen was like was the hot commodity. Nobody
Yeah,
is
yeah, yeah,
OTing
I
on
know, I know.
steroids.
Narcan
I
is
know,
to
but
the
that's not what's
US for
funny.
sure.
It's like.
Okay, so you had all these meds. Who even gave you all these meds? Like, was it the pharmacy at your like your hospital, or what?
This opportunity showed me that people are willing. And as I said in the
Mm-hmm.
beginning, if you're talking to everybody, telling everyone what you want to do and what you want to accomplish, you don't want anything from them, but you talk to everybody about it, and eventually people are like, "Oh man, this guy's so motivated. I want to help this person on their journey. I want. They're trying to help people. I can help them through them." Like, and people are motivated. They want to help, and so I straight up just walked into our pharmacy and talked to people there, and talked to a bunch of their directors, everyone else, and they were like, "Oh my god, absolutely. We have a bunch of stuff that's going to expire. Like, we can try to figure something out. Like, work
Okay.
something around the system to make this work." Because why wouldn't they? They were like, "These meds are going to expire, and you can go help people with them." And it turns out there's a couple other methods of doing this as well, talking to big pharmaceutical companies. I won't go too much into detail. It was some things I learned
Mm-hmm.
from these global doctors, like the ways to find them. But sometimes you can even find warehouses, things like that, pharmaceutical companies, and message them. And usually
Okay.
they'll
And
send
just
you
like
something.
email them requesting, like I'm going on this trip and I want medications donated, stuff like
Something
that,
like
or
that, yeah. And
okay.
sometimes at one point somebody was telling me there's even websites where pharmaceutical companies have like a large amount of meds that they just can't get, they can't sell. So they if you have a clinic, you have like a MD, you show them that you're going somewhere, they'll like send you these meds. And a lot of the times these are tax write-offs. So for
Okay.
them it's like a
Okay.
win-win,
For them, it's win-win. Okay.
Yeah.
And okay, so you have the meds. Was there any red tapes around leaving the country or entering Gambia with this amount of medications?
So I think that was one of the benefits of working with Dr. Cisse. She knew the country so well. She knew everyone at the airport. Everyone in the country basically knew she comes every 6 months and she brings medications and she brings help and she's there to help people. So she was able to wing a few things to get me into the country with a lot smoother. Even with that bag of medications, I just put my hospital ID in there and a signed paper from me and the pharmacist, just in case. Nobody ever bothered me. But interestingly enough, and I loved this, Dr. Cisse and I were talking about like little tricks and things you learn, like when you're going to countries, like what you need to know. And she was telling me, you need to get to know the health ministry of the country. You need to let them know you're coming in, have your like at least a license, some type of license showing you have MD. Going through, I thought it was funny going through TSA and places like that, especially in some of the like third world countries, like lower income countries. You got to bribe a lot. You bribe people, you kind of get through people. They see you have a bunch of
Mm-hmm.
medications, they think you have money. This type of mindset is going to be there. Oh, you're American bringing meds, you clearly have money.
Okay.
Give me something.
Did you all have to bribe anybody?
uh, I can't personally say what anybody
Yeah,
else in the
yeah,
group was doing,
yeah.
but no, honestly, the trick that I thought was hilarious was she just killed them with kindness. She was like, sometimes when that does happen every once in a while, I'm straight up like, oh yeah, I'm a doctor coming in from the US. I'm trying to help people. And then she said she just immediately switched the narrative. And she'd be like, hey, do you need me? You want me to check your blood pressure? You want me to check your sugar really quickly? And she had diabetic medications, blood pressure medication. She would basically set them
Mm,
up 6 months of medication. That's nothing for us picking up here. But for them, that's like honestly a year's worth of salary. That on its
right. So
own
you,
is,
mm,
yeah, you kill them with
right,
kindness. Like,
right.
yeah, you
Kill
actually
them with
help them.
kindness, or you bribe them with your medical knowledge, more or less.
Basically, a little bit of both, but like, how
Okay.
I say it, kindness inspires
Yeah.
kindness, man.
Kill them with kindness. Kill them with kindness. We'll take that. Okay. So you get how many days were you guys there for?
We were there for about 2 weeks, or about a week and a half, 2 weeks. We were in
Mm-hmm.
Banjul, the main city,
Mm-hmm.
and we were maybe 20, 30 minutes out from the city, kind of more towards where the village, like more away from like the big populated area, so a smaller clinic. And we were there for about a week, and we just worked nonstop over there. It was a small little clinic. I mean, I'm talking like chickens, goats, cats running around, people
Mm-hmm.
outside waiting in line, but it had so much stuff. I was so impressed. They had an OBGYN area that was just working so hard. They had a pediatric ophthalmology, acute center, wound care. It was very small, and like these are all rooms basically. But everyone was so on
Right.
top of what they were doing. It was incredible. Their work ethic, I absolutely loved it. Even some of the
Okay.
nurses I worked with that were helping our team, because we were basically, they gave us a couple rooms on the side to do clinic work. So we ran doctor clinic for like blood pressure, diabetes, arthritis was a big thing. Gastritis was huge. I was giving PPIs to everybody. Antifungal like tinea and foot fungal, different types of situations like that were what mostly they
Right.
were doing.
Mm-hmm.
But I would try to basically jump into the acute side. There was a whole acute area. We can talk about that a little later as well.
Yeah. Okay.
Yeah.
All right. So most of the time you spent in the small village that you were seeing at that clinic because you
Oh,
were there
sorry.
for
Yeah.
like a
So we
week.
were there for a week, and then after
Mm-hmm.
that, we basically went to Dumboto. There was a small, tiny village that was maybe 2 hours out, and that village
Mm-hmm.
was where we truly worked our hardest. Because that village,
Right.
they were out there in the middle of the night just cheering, clapping. I gotta send you that video, just
Was
cheering that
that
we
the
were there.
village? Yeah. Was that the village you told me like there hadn't been a doctor there? I don't know if you said ever or for
Ever.
like a couple of years. That kind. Mm-hmm.
They were like, no doctors ever come to the village. The closest center was maybe, I think, 30, 40 kilometers both ways. And most of them are all walking. Like
Right.
you don't see
Right.
cars all that often. You see donkey carts, you see different little things. You see those tuk-tuks a lot as well. But so if they have a
Mm-hmm.
medical emergency, it's like, it's difficult to get anywhere real. And then by
Need to
that
go
point, they're just
far.
getting to a clinic. They're not even getting to the real hospital.
Sorry, hospital. Okay, so
Yeah.
walk us through what it was like going to the village. I know you said they were very excited to see you guys. A lot of people came out. What was it like getting to the village and the clinic there? And what was like a typical day, in the clinic there?
Yeah.
How many patients were you guys seeing? What were you seeing?
So we, in the actual village itself, when we went out there, we had this solid team, and it was me, Dr. Ifit, Dr. Cisse, and then Hari. He's Dr. Cisse's husband, and honestly, without him, I don't think we would have been able to accomplish this. He was straight up our glue. He just kept everything running like a smooth ship, got us up, got made sure we ate something, made sure we got everywhere we needed to go. Honestly, was our pharmacist, was the one controlling everything, making sure everyone stayed alive, including me with some of the stupid shit I
Mm-hmm.
do. But like this man was truly just like, was on top of us, and it made me
Okay.
realize how important that was as well. Because of everything he did, every second he put in, we were able to help one more person because our mind wasn't
Right.
scattered on anything else.
So he was
So
kind of coordinating everything.
yeah, he was just the one that just made sure we were set and we were good. And we also had some nurses with us as well that came out. They were amazing. Some of them came from the main city as well. And then we had some translators in the village. So we got out to the village. We were working in a small makeshift kind of clinic, and they were building a clinic there because once they officially build it, get the supplies, then the government will consider sending them actual providers. So they were in the midst of like getting that going. So we had basically the framework of the building, just empty with a fan or two, like some fans here, like cloths covering the doors. And while we were there, we within 2 days, man, 2 days, three
Mm-hmm.
doctors, we saw over 300 something patients in those
Mm-hmm.
2 days. And I'm talking at that point, I don't think there's a picture of the room filled with people that never minimized. Every time I looked out
Mm-hmm.
there, there was the
Yeah, we
same
we
like,
went to that picture. Yeah,
yeah,
yeah. Mm-hmm.
same amount of people out there, and we were working nonstop. And at one point, like, so we're seeing everything. We're seeing blood pressure. So we're seeing everything. We're seeing blood pressure, gastritis, diabetics. We're setting them up with 6 months to a year's worth of medications. Basically everyone from freaking Senegal is jumping the border coming here because they know there's a doctor here and the doctor is bringing medications.
Mm.
Like we're not charging people. When we can't do it, we sign a piece of paper and it's like a pharmacy. It's like a little script. But majority of the medicines, we were basically our own pharmacy. Um, yeah,
Okay.
so we were seeing
Mm.
everything, and we would have acute cases come in, and thankfully Dr. Ifith and Dr. Cisse gave me like the free run to like handle all the acute care. If I ever had questions, these two had so much expertise and so much knowledge that they were
What
there for
was
me. Like,
what was some
yeah,
of the acute things you were seeing?
some of the acute things. So this was actually one of them was a little bit further out in the clinic, but it was a cardiac arrest, and basically they don't have anything but CPR. So that patient was brought in. We ended up doing CPR on them. They did their best, but a few things were off. So then after that patient passed, which I could see that they were going to pass. We didn't have much of a chance on that one because they were found down beforehand. I realized this was an opportunity to teach the squad, this group, how to do proper CPR, run up proper code with what they had, being like exact, because every second counts in CPR. That was an incredible experience to be able to teach them that and leave them with something that was lifelong, hopefully lifelong lasting. Like the other things I saw were respiratory distress as well. We had one guy come in where I literally could not hear breath sound, and I got excited. I had my needle out. I was like ready to do like a needle thoracotomy on this
Hmm.
guy, just pop a lung
Hmm.
open. But then listening to it a little bit longer, I could hear the bare minimum of it. Fluticasone pump, monitored him for every 5-10 minutes. I would check on him, give him another pump. I had a little bit of steroids, give him that, just watched him. And then he started feeling better. He was like, holy crap, I can breathe. Like he was like, I thought I was gonna die. We made him get a chest x-ray down in the city, gave him some azithro as well, because I just assumed it was COPD type basis. And it turns out that was kind of what it was. And he came back the next day, and this guy was so excited. He was like, bro, I'm not
Hmm.
going to lie to you. I just walked 5 kilometers and I have not walked that far in years because I could not breathe. This is the first time I've been able to walk like this. And it was incredible. It was something so small, like just a little fluticasone pump. That was it.
Yeah.
That's all it took to help this guy. And then dog bites, laceration repairs, knee effusions, things like that. Just a bunch of random things that I could do. And so I brought a bunch of like medical kits and emergency stuff to do what I could and then teach where I could. Yeah.
Okay. Um, what is the craziest experience, I guess, wildest experience you had while being out there? It doesn't have to just be with patients. It could be in the village, in the community,
Oof,
anything.
like that is a tough one. Honestly, just because that the cardiac arrest happened in my early few days, I would say that was the one because
Mm,
I
that
made
one stood
myself
out the most.
known and everyone was like, "Oh, this is an ER trained guy." And I was like, "Listen, I'm a resident, but I do have the background. I can help as much as I can." So while I'm doing the clinic, these nurses like they would just come grab me whenever they needed me. But this is the first they like swung the door open and ran in. They were like, "Dr. Bilal, she's dead. She's dead." And I was like, "I'm gonna be right back." And so I like put everything away and in my head I'm like, oh my God, like, what are we going to do? We have literally glucose and urine at this clinic.
But
And so, like,
they weren't speaking English, right?
no, so a lot of them speak English.
Okay, okay,
A
okay,
lot
okay.
of people
Hmm.
speak Mandinka and Wolof over there. Those are two
Hmm.
of the big ones. And I
Right,
tried to learn as many words as I can from there. Because, it always helps when you speak a little bit of somebody's language. I love
hmm,
that. But
right.
yeah, so those nurses, thankfully, a handful of them spoke English. And English is also really one of the top languages there, but everyone does not speak it. So most of the patients weren't really speaking English. So I had a translator. Yeah, so she like ran in and basically running that code, teaching them how to run the code, and then realizing everything I teach them needs to be correct because
Hmm.
they are taking my word as an American trained doctor. And so every time I said anything, I literally ran back into
Hmm.
the one corner of the clinic where there was Wi-Fi, and I'd like Google it really quickly and look around and be like, okay, okay, okay. And I would run back because I'd be like, I just want to double check I'm not saying anything wrong.
Yeah,
Because like
yeah,
we ended
yeah.
up
I
going through
feel
like,
that.
yeah, DKA lectures, CHF between CHF pneumonia, and yeah, telling the differences, how to give Lasix when someone, like how not to give Lasix just because someone has respiratory distress and a little swelling in their legs. It doesn't always mean CHF. How you can mess up someone's kidney, things like that. But it was like little things that I had to double check to make sure it
Yeah,
was proper.
yeah. Right, right,
Yeah.
right. And there's one story I remember you were telling me when you guys arrived to the village because they haven't like seen or they haven't had doctors there ever.
Yeah.
There was like not a ceremony, but I think you said everybody kind of came out. Yeah.
Yeah.
Did you have a, yeah, tell
I
me.
had videos of that. I'm gonna send those to you as well. It was honestly amazing. Then we finally get in there. It's pitch black darkness because there's not that many lights out on those roads, and we turn into this area, and there is just like a handful of these villagers just clapping and just saying welcome, welcome, and they're all so excited. And it was like shocking. We
Hmm.
had no idea people would be even awake right now. We were just expecting to meet with the village heads. And then we go inside, the village head is in there. There's a solid 40, 50 people in here just waiting for us. And it's pitch black darkness. Everyone should be asleep. They start giving us prayers and du'as as well. Like everybody, it's an
Mm.
Islamic country. They were very excited that we were there. They were giving us blessings. Dr. Cisse spoke as well. And they were just pumped to see us the next day. And they worked us hard, man. They worked us so hard. They
Yeah.
got every drop out of us. But like, I
Yeah.
understand why, because they don't
Yeah.
get this type of like people coming out very often. And even at the end of it, they apologized because at some point they saw that we were like frustrated beyond measure, not because of them, but because of the patient load, the
The
heat,
volume load.
just the
Yeah.
everything, and like trying to be there. But like they would always keep, they'd be like five more patients, and then there'd be 20 patients, then there'd be like two more patients, then there'd be another 10 patients. And like at one
Yeah.
point, you're like, dude, I can't. I like my brain's off now, and you want to help
Yeah.
everyone, but even that also
Hmm.
taught me. I was like, you gotta find your way to pull back. Like you have to
Yeah.
have a social battery, like a level of mental battery to be able to give proper care as well.
Yeah. I know
Yeah.
what you're doing. But let me ask this. Considering that it was high volume, high stress, you didn't have a lot of the tools that you would have in the US. But it is in a community where there is such a great need. Do you feel like it felt more meaningful or more impactful for you to practice medicine in a place like this versus how it would feel in the US? Like how, in terms of how it felt, how would you say?
Yeah. Justin, just to start that off, I would say
Hmm.
overall, I was 99.9% sure this is what I wanted to do. And then I spent 2 weeks in the heat with barely a fan, just nonstop patients, the most I've ever seen, and a level of frustration when I couldn't see more. And I loved every second of it. It was
Right.
incredible, man. Like this was what I was meant to do. This type of work. Like I want to do emergency medicine. I love emergency medicine. This is what I plan on doing. But I want to combine it with global health medicine. I want to travel. Like it felt so much more meaningful, man. I'm telling you, like I give Dilaudid to patients here, and they curse me out because I'm not giving them enough Dilaudid, and they want zero pain right this second. And I was giving Tylenol and Motrin and like small doses to people, and they were blessing me with their core of their soul, and they were like, everything you're doing here is changing my life, like to give them a little bit of relief because they're walking all day every day. Like a little bit of relief made such a difference in them, and it felt, yeah, it felt so good, man. There were people that had migraines and they didn't understand. And you know, people here have a migraine for one day, they freak out, they're like, oh my god, the
Yeah.
world's gonna end, I'm done, it's over. like
Yeah.
like these are people that were describing symptoms to me, and they were having full-blown migraines, and they were just living their normal day because there was nothing else
Wow.
they could do about it. And they were having migraines, completely normal, gastritis pains that they just couldn't do it. Dizziness and passing out over and over again because their blood pressure was over 200 systolic, and they just didn't know why. So they just kept living.
Mm.
Like, what else are you going to do? You don't really
Wow.
have the money or the funds to go like further to research this or figure it out. So to be able to literally in a 5 minute conversation decipher that someone just has a really bad blood pressure, or their sugars are super
Hmm.
high because they're diabetic, or that they're simply having migraines, and be able to give them, or even dehydration headaches, and give someone the right idea, be like, oh, you're just really dehydrated, you need to drink more water. They're like, oh, I drink 2 bottles a day, that's a lot. I was like, no sir, that is not a lot. Like, and with
Yeah. You
you in
need
the
more.
heat, like you need more. Is that simple stuff to us is normal.
Yeah.
It was so
Things
impactful
that
to
we would
them.
take for granted. Yeah.
Yeah, it
Yeah.
made a
Yeah.
huge difference, man. And it made me
Yeah.
like, I love this type of work. Like my goal is 9 months of ER all year, and 6 to 9 months, and then at least 3 months, maybe like just out and about doing this type of work. And the more I did this work, the more it made me realize the direction I want us to go when we create this beautiful, beautiful foundation one day. Um,
Eventually.
we will. We're gonna get there, man. It doesn't matter how long it takes. We know what we want to do. We're
Marada.
gonna get there.
Marada.
Marada. There it is, man.
Yeah.
Marada.
Uh-huh.
But like, all it showed me was like, I even with Grenada and Carriacou, everything that's happening out there right now, I was like, to
Hmm.
create something that is close as we can get to acute care, first responder type care,
Yeah.
disaster type medicine. I was like, I think that's kind of the route that I want to go. But I know that the more experiences I have, the more global trips I go on, the more doctors I work with that do this like
More connections you
multiple
make.
times a
Yeah.
year. It's more
Hmm.
connections, more perspectives, more ideas, more finagling methods, how they get through situations. Like this is how we're gonna build something real, by using everyone's
Yeah.
experience.
Yeah.
Like we're not
Because
gonna
I
waste
know you were
this.
saying too, I know you were saying with everything happening in like Hariku, one of like you were kind of disappointed that because of residency, you wouldn't really have the freedom to go help
Yeah.
in whatever way you could. you know.
Dude, even
So
even that, Yulia, our friend, like she went
yeah.
out there, and so one, I was
Hmm.
frustrated I couldn't go because of residency. She is an attending now, and she actually went out there, but because of the Red Cross and a few of the other big organizations, there was so much red tape, she could not even help. So they have
Right.
an attending on the island that they wouldn't allow to help because they were like, oh, it
Right.
takes too long for us to figure this stuff out. And I know there are reasons there's red tapes a lot of times, but there are situations where like you need people with knowledge and the passion and the desire to do this kind of work. And if we can create something real and find a way to zigzag around the red tape while being kosher about it, you know, taking care of like I know
Right.
there's somebody from Red Cross going to see this or some big organization be like, there's reasons we have red tape.
Flag.
Like I yeah, I understand,
Get
but
us
like
canceled before we even begin.
yeah, I know, but like I hope that we can do something real with this. Like
Yeah, for
yeah.
sure, for sure. And just to wrap, what advice for anybody that, either is in medical school or in residency that may want to get involved with something like this, general, what advice would you have?
The advice I have is if this is truly something you want to do, talk to every human being about this. Everybody, you never know who somebody sparks up. Be like, oh, that's what you're interested in. I was just in Gaza last week. I was just in some other country the other day. Like I was in Ethiopia. Like I was doing disaster. Like you never know who's going to be able to open a door for you. Is what I'm trying to say. There always are other ways. A lot of hospitals, when you're doing residency applications, talk to them, see if they have electives already set up because that makes it so much easier if there's already a connection in the
Mm,
hospital. Just
true.
know
Electives, right?
yeah, there's always a way. And the whole point of this is you can do global health fellowships, all this stuff. But the whole point of doing it now is because you want to do this and you want to get out there. And the more you're out there, and it's just like hospital, the more you're at work, the more patients you're going to see, the more you're going to know. The more you're out doing this global medicine work, the more doctors and other people you're going to know, the more experience you're going to get, and the more idea you're going to have of understanding of what you want to do with global medicine, or if this is really what you want, or if you're doing it for the clout. You're like, oh yeah, Instagram, like I'm out here helping these kids, like
Right,
those
right,
are
right.
yeah. But you figure out what's real to you, and when you're sitting in that 110-degree a little like clinic like with a fan and there's beads of sweats
Uh-huh.
going down your face and you're still smiling, that's when you know it's about it. You're about it. It's
Right,
for you.
right,
Yeah.
right, right. All right, well, I think this was good. Nice little summary on your
Yeah,
experience and the advice for anybody that would want to get involved. Thank you for speaking with us.
I appreciate it, man. I just want to give one big shout out to
Hmm.
Dr. Nafi Sise, Dr. Ifith, Hari, everybody that helped us out in Gambia as well. This experience, I already knew this is what I wanted to do, but man, this
Hmm.
skyrocketed to me. And having those two strong, absolutely independent women like showing me like what they did, how they did things, and how freaking powerful of an impact they were making just got me even more pumped to be in this field, to get into this. Like yeah, I'm excited, man. And
All right.
I'm really happy I got this experience.
Yeah, shout out to them. All right, Dr.
Absolutely.
Tasneem. All right, Bilal.
All right. Thank you, brother. I appreciate it.